the population that we deal with are some of the hardest hit. It's time for people to realize that AIDS is not a moral issue, but it is a health issue. And these people pay the most.
We're looking at individuals that are making a lot of profit, hospitals that are making horrendous profits, and individual doctors that are making horrendous profits, as well as pharmaceutical companies, multinational pharmaceutical companies that are making huge profits, and they don't want to give up those profits because they know that with a national health care plan, it means that there will be a set fee, and the profit margin will be reduced.
The Harlem community and the South Bronx, for instance, are going through major health epidemics of, enormous proportions, comparable to anything existing in the third world right now. But we have so little provision of medical services and so little resources that, we're looking at not only infant mortality rates, but premature morbidity and mortality rates for young women and for young men.
For women particularly, the system is not responding. There's no access for a lot of women for basic family health care that is necessary. The women usually are caregivers. Women take care of everybody in the family, and then they take care of their own health only if it seems to be some kind of emergency.
What we're talking about here is that the Clinton presidency and the shift in the political winds is opening up the space for political issues that have been completely marginalized. We're not even talking about the back burner here. We're talking about people who didn't even know about lesbian breast cancer and still don't know. We're talking about sexual orientation is not even in the radar screen of the folks that are writing the questionnaires for the NIH studies on women's health. So we're talking about very basic stuff, and it's similar to other particular needs of the community, like fighting lesbian and gay teen suicide.
People have to understand in terms of the healthcare debate is that it is, first of all, not a healthcare debate. It is an economics debate. It is quite the same thing as tax reform. When we ask the rich to start paying their fair share of taxes, they tell us how terrible it would be for the economy. When we talk about national health care, people tell us all kinds of reasons why we shouldn't do it. But it's basically an economic issue. We are spending $950 billion a year on health care.
I would say one of just the generic population, I think the biggest impediment to people going in and getting health care is economic. If they have to, for example, if they have to put up a couple $100 up front, even if they've got insurance, even if they know they're going to be reimbursed, if they have to have cash out of their pocket at the time of visit, even sometimes $40 could be too much. And it's a matter of paying the rent or having that visit or knowing that they're going to have to put the cash up front, so they've got to save through several paychecks to get that cash. Those several